Hello, and welcome to the Therapy Circle with Tiffany Petite, co-founder of Virtuous Circle Counselling. This podcast opens up about experiences, challenges, and triumphs that are often discussed in therapy, all while bringing you insightful reflections from a therapist's perspective. We're diving deep into authentic conversations, but before we dive into today's episode, it's important to note that while our discussions are rooted in therapeutic principles, they are not a replacement for professional therapy, and the information shared in this podcast is for informational purposes only. Listener discretion is advised. Hello, and welcome to the Therapy Circle, episode 4. I'm joined here today with Dr. Tzipi Buchman Wildbaum, who's going to speak to us about chronic illness. And I just want to thank you so much, Tzipi, for sharing your time and expertise on this important topic.
Of course. Thank you, Tiffany, for having me.
Thank you. And so, Dr. Buchman Wildbaum, can you please share with me, what inspired your interest in wanting to share with the listeners on chronic illness, and how is that relevant to your clinical practice?
Yeah, so maybe we can start with a short clarification when we talk about chronic illnesses. It's really important to emphasize that chronic illnesses can be basically any health condition, if it's a physical or mental health diagnosis that is long-lasting and is affecting people's life and functioning, day-to-day functioning. Now, what inspired me was that, from my years of clinical experience working with individuals coping with chronic illnesses, I did notice that there is a discrepancy between people's experiences, what people are actually sharing in practice, in real life, and then the focus that is being addressed in medical practice, in therapy, basically, which was more focused on symptoms management and quality of life. But what I did notice working with people with coping with chronic illnesses is that people were actually experiencing and reporting on this massive sense of sadness and losses, so many losses, and also grief. And this is not something I encountered before. This is not something that is widely identified, I think, in the clinical practice, because when we think about grief, it's very common, you immediately think about the loss, losing someone you care about, the passing of someone you love, and then it's very evident and very acceptable and to be expected, actually, that someone is going through a grieving process. But you don't really talk about it when you think about people are coping with chronic illnesses. So that discrepancy actually made me really curious and made me focus, while working on my PhD research project, specifically on the elements of loss and grief.
Fantastic. Wow.
Yeah. And, after years of working with people coping with chronic illnesses, I did notice that they're reporting on so many different aspects of losses. Also loneliness and shame, very, very important, crucial aspects that are important to address in therapy. Now, when I went back to the literature, I was actually very surprised to notice that it was widely documented that people are coping with chronic illnesses are going through these processes of loss and grief, but no one is widely talking about that. So that was where my passion was at the time, and what led me to invest more time and working more on these elements.
Yeah, absolutely. And on that note, I'm so glad that you're here today to kind of help spread the word. And I think that's super impactful to articulate and correlate grief in conjunction with the experience of chronic illness. And when you think about chronic illness, you often consider the physical implications, but not necessarily
Exactly.
the mental and emotional toll that
Exactly.
chronic illness can play in. How does that inform your clinical practice, Tzipi?
Yeah, That's a great question. And I wanted really to mention that when we talk about losses, as you said, there are the more physically evident losses, like the loss of functioning, loss of emotional, cognitive functioning, loss of employment
Mm-hmm.
possibilities, loss of your social circle, living situation. But we don't really even consider the other aspect, the less physically evident losses, which are more the symbolic losses, like the
Mm-hmm.
loss of someone's sense of self, self-worth,
Mm-hmm.
self-esteem, the former life that you used to have before having the illness, losses of all the dreams and hope you're having for your own future.
Yeah.
And this is very important to address in therapy and to talk about and to ask more, because we already know that grief, for example, is associated with avoidant behaviors and symptoms severity, quality of life. And actually, in my PhD research project, I was actually able to prove and document these experiences among people who are coping with mental illnesses, and their grief experience found to be related to lower willingness to ask for help, to get help, and to adhere to their medical treatment more specifically. And
Wow.
that can have huge implications, right? I'm not
Huge.
even talking about the emotional
Huge.
consequences, but the physical ones too
Yeah.
in managing the illness.
Yeah, huge. And I like, as you say that, I just sort of like sort of my heart drops, right? Like when you think about people who are struggling with so many powerful changes in their lives, the implications not just on them, but the relationships that they have, and their support systems, and trying to, like, not just grief those, but how those interchanges
Exactly.
play and influence things. When you talk about, Tzipi, when you talk about some of the coping strategies, what might be a common difficult coping strategy that sometimes people resort to with chronic illness?
So I find the most common experience is actually
Mm,
it's related a lot to the shame experience and stigma, which is unfortunately very much common when we talk about mental illnesses.
mhm,
So stigma is still very much prevalent, and people find themselves really ashamed because of their situation, which leads to social avoidance too, and basically, prevent these people from getting the help they need, the social support they need. So I found that to be the biggest one. Just the loss of relationships, the loss of
mhm,
um, support, employment too. So
mhm,
people find it really more difficult to function, to keep their daily routine.
mhm,
So I think that first of all, it's very important to talk about all these elements and experiences. Just talk about the stigma and also name. I find it very, very important when I work with clients just to ask more about their life before the illness, about all these losses, to acknowledge the losses, to name the losses,
yeah,
validate those losses because they are real.
yeah,
Um, Having the diagnosis of chronic illness affects everything. It leads to so many changes, changes even, when we talk about the family structure. It affects
mhm,
everyone. It affects the siblings. It affects the parents if we're talking about a child. So it affects so many different elements. But for some
mm,
reason, people just don't feel that they can talk about those things. So one
mhm,
of the big differences when we talk about grief, when we compare between grief that is being experienced by people who lost their loved ones, for example, and people who are coping with chronic illnesses, is that
mhm,
with chronic illnesses, this grief found to be more complicated in nature because it cannot be openly discussed or talked about, right? When there is someone, when we lose someone that we care about, it's very much acceptable. We get all this amazing support from our society, right? It's
good
completely
point.
okay to take some days
Yeah,
off from work. But when you get this diagnosis, there is very minimal support that is being offered.
mhm,
um, so it's more complicated. Also, there is no very clear lost object. When we lose someone, it's very clear what we lost. But when we talk about chronic illnesses, as I said, there are many symbolic losses. It's very hard sometimes for people themselves to understand, to comprehend. Also, these losses keep changing. They're never-ending losses. They're evolving as the illness itself. So there are new losses. Their meaning keep changing throughout the years, and that makes it very complicated. So we're talking about pretty much this never-ending sense of grief and loss that can be delayed and can be very tricky if we don't address it properly.
Wow, like so many things just coming to my mind to
Share
unpack,
with
and
me, Tiffany.
things that I want to ask you, right? Like, and I think that is a bold and very important headline that you shared there. That people sometimes don't know how to support somebody with a chronic illness because this sense of grief and loss is sort of an abstract idea, right? There is no sort of fundamental ritual, for example, of what comes next when you're losing something, such as your health or your well-being.
Exactly.
For the purposes of clarity, can you give us some examples from a broad term? Because like I think chronic illness is sort of seems to be like a really big topic, right? Can you give some examples, Tzipi, of what would be considered as a chronic illness for many people?
Yeah, of course. So if we're talking about mental illnesses, for example, we're talking about, the depression, anxiety, schizophrenia, like, there is a wide range of different mental health diagnoses there. When we talk about physical illnesses, we're talking about it can be heart disease, diabetes, epilepsy. There can be so many, dementia, even. There's so many different health conditions that can expose us to so many challenges and changes, and I'm not even talking about the management of symptoms that is challenging enough and can lead to a lot of burnout and stress in our day-to-day life. But the emotional aspect is very, very important too to address. And with mental illness, there, stigma exists also when we talk about physical illnesses. But when we talk about mental illnesses, I feel like there are a lot of, misconceptions and stigmatic beliefs that are very important to address, just to allow people to get better support for their condition.
What do you think, Tzipi, is like a contributing factor to being more resilient, for clients to become more resilient through the processing of a new diagnosis or a chronic health condition? What do you think helps people through those sort of episodes in their life, or how to cope more effectively?
Yeah, so what I do usually when I work with people, first of all, other than, as I said before, acknowledging all the losses, asking more, exploring more about life before diagnosis, what is also very important is encouraging. I always encourage people to gain more knowledge and information. I do believe that knowledge is power. That can make a huge difference. It can help people making sure they're getting the best possible care, the highest standard of care, which can affect obviously their symptoms and management, and also can help make life more predictable, illness more predictable, which can reduce stress. Also, knowing your rights, right? If we're talking about chronic illnesses, many times, unfortunately, people find themselves having to advocate for themselves, or a young child that is being diagnosed. So knowledge is big and is very, very important. Another thing that I found to be important is reaching out to others, reconnecting with people, maybe that going through the same experiences is also important, because isolation can be very, very big. Chronic illnesses can be very, very isolating. It can be very isolating experience. So reaching out to others, getting the support you need is very important. Another thing that I found to be very important is, especially when we talk about grief, is working towards acceptance of the new reality, because a big part of, when we talk about grief, is all the, denial
Yeah.
and difficulties in accepting the new reality, accepting the new situation. And many times that can affect someone's willingness to ask for help, as I said before.
Yeah.
So working towards acceptance, finding new meaning to life.
Yeah.
What is really important for me, um, that people will understand, is that having the diagnosis of chronic illness does not define who you are, does not define who you are as a person. It doesn't need to determine or dictate your life. So it's still possible to make all the dreams that you had before come true. um, it's right that maybe life will look differently. Maybe there are other ways of doing things after diagnosis, but it doesn't mean that you shouldn't. You're not deserved to have the life that you always envisioned to yourself. So life can look different, but life can still be great. So separating the individual from the illness, I found to be very, very important. Chronic illness does not define who you are, and that's something that is always important for me to emphasize when I work with people. Yes.
Very important.
So there are many things we can do.
Many things. You talk a lot about, I want to kind of continue the conversation around acceptance. I find personally that sometimes people have a reluctance to accept the things that have developed in their life or changed that have impacted, let's say, even their mind body connection, right? How can we, implement, the physiological well-being with accepting the physical management of some of these conditions, perhaps, right? Like, if, how do we encourage people to pivot towards acceptance? Where do we begin, if somebody's really struggling to accept these new changes in their life and the costs of those things?
Yeah, so I think that big part of it, as I said, is acknowledging all the losses, talking more about the dreams, talking about the hopes that one had for their future. I think that's a big one, because most often people are pretty much overwhelmed with all these changes. They feel like they can't talk about it. They feel like there are no chances for them to have the life they envision for themselves. So acknowledging, talking more about the meaning of the losses, talking about the future, finding new meaning to life, talking about making sure that we mentioned the physical implication. So addressing those too is very important, making sure that people are getting the help they need in managing their symptoms. And I find it very, very common, actually, when we start talking more, when we start validating, normalizing these experiences more, something I feel that people feel more relaxed and more free to share those experiences, because most of the time they're just being left unspoken.
I appreciate that, though, Tzipi. I want to jump in because I think that, as caregivers or support systems, sometimes I think people are cautious about validating or normalizing those things for fear of worsening what somebody deeply already is experiencing. So there's this sort of
That's a great point.
debilitating fear of saying the wrong thing, so we're not saying anything at all.
Exactly.
And it's similar in grief, right? When somebody loses a loved one, I think there's such a mystery about how to approach the topic, because we're always in our heads about saying the wrong thing. Would you like echo that, or what are your thoughts on that?
Yeah, I completely agree. And one of the things I find to be very helpful is also involving, for example, family members in therapy, just allowing families to have this self space to share more of these experiences, because it's very common, for example, for kids, to feel guilty sometimes for all the changes that their illness or their condition brought to to the life of their family members. And so kids tend to blame themselves. They feel guilty, and for families, it's very, very complicated experience to address. So even among our family structure, people don't really know how to address it, how to talk about it. So just allowing this space in therapy to
Yeah.
talk about these things, about these experiences, about expectations,
Mm-hmm.
is very important and can be very empowering. Sometimes even caregivers,
Mm-hmm.
they don't really feel comfortable talking about, the responsibilities and the burden that
Mm-hmm.
involves in caring for someone with chronic
Mm-hmm.
illness. They feel guilty too,
Yeah.
because it's not they're going through this condition, their child is going through this condition, and that's a lot to manage, and
Yeah.
that is very stressful experience, but people just don't feel comfortable talking about it. I feel guilty. So
Yeah.
there's so many elements to it, so many experiences to talk about and
Yes.
share, and it's
Mm-hmm.
important to allow this space to really talk about those things that people
Yeah.
don't really feel comfortable talking about.
Yeah, something that comes to mind, like as we're sort of again brain, like sort of having this awesome conversation, are cultural considerations. And I think that
Hmm.
sometimes, as providers, we may or may not consider cultural implications to talking about chronic illness and how that culture may or may not speak about certain conditions or health concerns or the roles of families through a member who's not well or going through a
Hmm.
chronic health condition. What are your thoughts on cultural considerations on the topic?
That's very important, especially when we talk about stigma. For
Yeah,
example, there are cultures where stigma is more prevalent,
yeah,
and we know that. And then there is the question of, are these losses are really being acknowledged, being considered? Many times people are struggling to understand
mm-hmm.
what's the big deal, right? I mean, someone is having this chronic condition. Well, okay, they're just being expected to deal with it.
Yeah,
The people don't really consider all the things that come with it. So in these kind of cultures, especially, it's more common to see this, circle of shame and loneliness and isolation. Uh,
mm-hmm.
People don't really talk about those things.
Mm-hmm.
They don't even consider those things. We see it with mental illnesses
Mm-hmm.
a lot, that no one get this get well card after they're leaving the hospital with a new diagnosis, right? No
Yeah,
one is even talking about that.
yeah,
But it's not so different than having any other physical condition, right? Or
yeah,
health condition.
yeah,
So that is definitely important to take into consideration. That's why I feel that awareness is really, really important. Educating, even when we talk about health professional, right? We're talking about psychologists, social workers, psychiatrists, nurses, all these things. We definitely need to increase awareness uh, when it comes to all these elements that are very, very important to address, because they affect so many things.
yeah.
So even among ourselves, the health professionals, it's really important to bring those things up.
Fantastic. Yeah, I couldn't agree more. And you mentioned about self advocacy. And I think one of the things that I wanted to revisit and highlight, which I think is true, and I completely agree with you, is the element of peer support and seeking out information. And I've experienced personally people in my clinical practice where they had a very rare, or they or someone they knew had a very rare genetic disorder or
Mm.
disease or something, right? That was so rare. It was very difficult to get information, except I found, groups and platforms on social media like Facebook, for example. You can type almost any type of chronic illness out there, and there's a group for that. I don't know if
Mm.
you found that, and those um, forums, those outlets for people to connect with people experiencing something very similar or have been through a similar path, have been foundational in opening up avenues for clients I've seen that they otherwise would have been um, shut out from. What are your thoughts on that too?
Yeah, I think that these platforms are really, really important.
Hmm.
I do feel that we need to create more formal platforms
Yes.
because
Yes.
this kind of support is very much lacking,
Yeah.
unfortunately. So people are looking for support. The one are looking for support are looking everywhere,
Yeah.
and it's great that we have these groups, because people get a chance to exchange experiences.
Yeah.
What I found working with people is that many times when we talk about these experiences, people are like, oh, really? Is that so common to experience? I didn't know that other people feel the same. I didn't know it's okay to have
Yeah.
those feelings.
Yeah.
So I cannot emphasize enough how
Yeah.
important it is to get this support, this social support.
Yeah. Yeah. And tell me what you mean by formal support. Like what would that look like? If you had like the sort of the magic wand and could create some of the things that you've noticed are missing, what would that look like?
So I'm mainly thinking about, when someone is being hospitalized or the first time they get their diagnosis of chronic
Mm-hmm.
illness.
Mm-hmm.
Um, I- that could have been great if, hospitals will have the enough support, different options for people to get support, to get the knowledge they need, but also exchange experiences.
Mm-hmm.
So that is unfortunately, I
Mm-hmm.
find to be lacking.
Yeah.
Obviously, when we talk about public system, there is not, sometimes resources can be lacking and there
Yeah.
is no such support, but having this framework of group therapy, for example, of just allowing the space for people to just share experiences,
Yeah.
talk about life before and life after, that is very important,
Yeah.
in addition to gaining all the knowledge and information that is
Mm-hmm.
out there, because people also don't really know what
Yeah.
can they do to improve or to manage their symptoms better, for example.
Yeah, excellent point. And I noticed that you said that acceptance is the first part, and which is also a part of a stage of grief, right?
Yeah.
What are like if we're going to use that sort of analogy of like a grief cycle, what are you familiar with are parts of those journeys, and are they fluid? Do they ever
Hmm.
resolve?
That's a great question, because when we talk about chronic illnesses, as I
Mm-hmm.
said, grief can get complicated, and the nature of grief can be different than what we expect in,
Mm-hmm.
when we lose someone that we love.
Mm-hmm.
So usually we see those stages, very clear stages. When we talk about grief, we talk about denial and anger
Mm-hmm.
and, just really hard time in accepting the loss,
Mm-hmm.
and the new situation. When we talk about chronic illnesses, because of the never ending experience of losses, there are also constant reminders of the losses. For example, someone with the diagnosis of chronic illness, they, can see their friends doing all these things that they never get a chance to do, or they maybe
Mm-hmm.
will never have the chance to do. So there are all these developmental stages
Mm-hmm.
that are, a constant reminder of the
Mm-hmm.
losses and the things that the impact of the illness has on your life. So
Mm-hmm.
we can see that the stages are not very clear. It's not so predictable, this whole process, and mainly to when it might end,
Mm-hmm.
because as I said, there are just constant losses and reminders of
Mm-hmm.
the losses,
Mm-hmm.
constant challenges. So that can get complicated, and also complicated to track too,
Yeah.
and identify.
Yeah.
So that's something that is really important to be aware of.
Fantastic. Yeah, you mentioned something earlier as well about self-advocacy. Can you tell me a little bit about more? If somebody's not necessarily, let's say even before their chronic illness, they weren't really good at practicing boundaries or
Hmm.
self-advocacy or the ability to really, push and clarify, and they know something's not right, but they don't have those skills. Like, what are some of the things that someone can do, perhaps even with a professional like yourself, a psychologist, to self-advocate and give people an opportunity to empower themselves through their chronic illness?
Hmm. So yeah, I think that working on gaining tools, to better, as I said, communicate, identify even your own needs, that can be challenging too, for some people. Just knowing what you need, identifying what you need, and then we can work better on communicating those needs.
Yeah.
Um, so I think, well, with the work of talking more about those losses, talking about this life changes, that can help in identifying all these emotions and needs, and working on how to communicate these needs, and gaining knowledge. As I said, when you have better knowledge, you can do a better job in advocating for yourself. Yes, so that is really important. And sometimes, as you said, people can struggle with that. So
Yeah.
getting the support you need is very, very important. Just exploring more about the experience of other people too, learning from others. That can be
Great
very
point.
important.
So powerful. I do think that there is some comfort in knowing, seeing ourself in others. There's some comfort in knowing we're not alone through these
Exactly.
challenges, that somebody out there has been through something similar. Obviously, every person's unique and their experiences are unique, but there is comfort in knowing that you're not alone through this.
Exactly.
Yeah.
Exactly. And that's important, especially important when we talk about chronic illnesses.
Yeah.
For example, among kids, when we
Mm-hmm.
talk about, for example, type 1 diabetes.
Mm-hmm.
Before it was very, very accepted to think that, only like maybe adults can get the diagnosis of type 1 diabetes. Now we
Yeah.
see younger kids or experiencing those things and getting this diagnosis, and people
Yeah.
often find themselves very much confused about
Yeah.
this condition, this situation. How can it be that a child so young can get this diagnosis? There are all these misconceptions too about this condition. So
Yeah.
that can be very, very challenging for people to comprehend.
Yeah.
Um, so that is important
It's
to
a really
address.
good point. I've noticed the impact in particular with some of the clients that we see at Virtuous Circle Counseling, where we've worked with young athletes, for
Hmm.
example, who get a recent diagnosis of type 1 diabetes, and how that influences the goals and dreams that they have within their performance, within their sport, and how to make meaning on the implications of type 1 diabetes, for example. And so, obviously education, like you said, is key. Um, but those are really relevant examples, I think, of how and how even a young person might be experiencing a significant change in the ways in which they have to do things in order
Yeah.
to keep fulfilling their dreams and purpose, such as team sports or whatever it might be that gets you have to factor those considerations in.
Exactly. And especially, as I said, with conditions that are not maybe well known,
Mm-hmm. Mm-hmm.
that's especially important because among the public there are lots of, knowledge information that is not very accurate.
Yeah.
And that only, leads to more isolation and more loneliness for people and
Yeah.
less willingness to share and tell about their story and experiences.
Yeah, that makes me curious, Zippy. When you have a client who's coming into session, what would give you the like, ooh, like, oh, like, tell me more about that, or somewhere where someone may have gotten misinformation. What are some of those avenues that you would caution people to go down the rabbit hole on?
So when I see people who are coping with chronic illnesses repeating these misconceptions, for example, or really believing that their future cannot look like they imagine to themselves, or
Mm-hmm.
basically just repeating all this, false information
Mm-hmm.
about the meaning of a certain chronic condition,
Yeah.
that's when I feel like, whoa, wait a minute, it doesn't define who you are. It doesn't
Yeah.
mean that this is how it's going to look like.
Yeah.
Many of these, occasions in the beginning when we get this diagnosis, it can be very overwhelming, and it seems like life can never be the same
Yeah.
as it was before. But
Mm-hmm.
that's not true, right?
Yeah.
And we know that because life just, life keeps moving and things keep happening, and
Yeah.
we just live our life and we learn more. And I think with more support and information and empowerment of people, we can, things can be experienced differently
Yeah.
and feel different. So when I hear people just repeating these misconceptions and really believing that, things are different, things will
Mm.
never look the same, that's when I feel like, whoa, wait, we need to really explore more
We
about
need to
it, like
tackle
what.
that. Yeah.
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 So that's when it's really, really important to talk about the vision, the life they had before, the life
Yeah.
they're going to have from now on, their dreams, their hopes.
Mm-hmm.
Yes,
Very good. What I hear when you say that is planting a seed of hope.
exactly.
And and
Yes.
and really, like, what do you see is the secret sauce for hope? How do you
Mm.
cultivate hope? How do you grow it? How do you really believe it, right? If somebody truly feels stuck or entrenched in this idea that their life as they knew it will never be the same, how do you grow hope from that grief?
So I think that having a sense of control is very, very important because we know that when we feel that we don't have any control over our life or over our condition, it can
Yeah.
really lead to hopelessness. So helping people feel more in control over the symptoms of their condition, for example, over their life, over their future, that can be a big, big piece. That can be very empowering.
Yeah.
And as I said, knowledge is big piece in control and feeling more in control, because when you have the knowledge, you can feel that life is more expected. You
Yeah.
can expect what is about to come next. So that's a big piece. And when you feel more in control, you can start imagining your life. You can start building your life again. You can
Yeah.
find new meaning to life again. So I find that to be very helpful by itself, just cultivating a sense of control and sense of hope.
Wow, beautifully put. I was actually just inspired because I think these things are so transferable in so many people's lives, right? This feeling of like having a sense of control is key, right? In purpose driven um desire to self improve, right? When you feel you have agency and you feel you can
Exactly.
have a sense of autonomy in your
Exactly.
in your life, I think you hit the nail on the head.
And I think also feeling that you have a say, even when you work with your doctors,
Yeah,
feeling that you can contribute to your health, that you have control over your care, that you can choose, you have the autonomy
yeah,
to choose the best treatment modality for you. I
yeah,
think that can make a huge difference
yeah,
in helping people, because most of the time, we all obviously tend to immediately adopt what we hear
yeah.
from our doctors, which is very important, but it's also important to gain more knowledge and at the end to make these informed decisions about your own care and about your life. And I find it very, very helpful for people.
Oh, I agree. I think that that's really wonderfully said, and I appreciate you doing that. While we work to close up, is there anything that you think that people should know that we haven't talked about? Is there any, like, final message that you'd like to share?
Well, I think that what is important for me to emphasize is that I really encourage people to just reach out whenever you feel stressed and anxious, and when the future is so uncertain and you
Mhm.
feel that it's just too much to handle. Just reach out to others, because I promise you there's so many people out there who just feel the same, have the same experiences. And as I said, the coping with chronic illnesses can be very isolating, but people don't need to deal with it by themselves. So that's what is really important for me to emphasize, and also the fact that the illness does not define who you are. You are not your illness. Life can still be great. Life can still be good. You can still accomplish all of your dreams and plans. Things might look different, but it's still possible to have great life, and you do deserve to live your life to the fullest.
Mhm.
So don't be afraid to reach out.
Fabulous. Fantastic. And so, anybody who's listening, who's located in Alberta, if you're interested in having a call or working with Dr. Tzipi Buchman Wildbaum on this topic, or any others, I think be happy to share, how to contact you, Zippy. And I just really appreciate everything that you said today. It was very inspiring and insightful for me to learn from you.
Mhm.
And
Thank
and
you
I
so much,
appreciate it so
Tiffany.
much.
Thank
Yeah,
you for
thank
the
you for being here.
opportunity.
Fantastic. All right. Thanks.
Thank you.
Thank you for spending your valuable time with us. Remember, everyone's journey is unique, so what works for one person may not work for another. Take what resonates with you and leave the rest. If you enjoyed today's episode, please subscribe and review. If you'd like to learn more about us, please visit bccounselling.com.
Go get it.